So far, what have we learned for the last couple of days?
We did the circulatory system.
We did the circulatory system, we did the basic, the roots and all that, right? So today we're going to cover nervous system. Cephalo is head, usually cephalopathy, the disease in the head. Encephalopathy, there's pressure buildup inside the head. Okay, so anytime when you see cephalo, that's head. Cephalgia, that's a fancy term of calling a headache. Right? And cephalo inside the head, inside the brain. Mening is the membrane surrounding the brain. Meninges is the lining epithelial cells inside the brain. Okay. So meningitis, I think you've heard of it before. There's different types of meningitis. It could be caused by bacteria. It could be caused by virus. Okay. Spinal cord, myelogram, X-ray of the spinal cord. Neuro is nerve. Neuroma, neuritis, neurology. Those are all related to nervous system. This means difficult, painful, abnormal. For example, dysphagia, meaning difficulty in swallowing. Okay, dysplasia, the abnormal tissue layer. So whenever you see the dys, that means is difficult, abnormal, or painful. Dysfunctional is not functioning well. Okay, so those are the terms. Sali, a lot of time meaning is almost like a little protrusion from a normal anatomical position. It could relate it to anywhere in the body, not particularly in a specific body site. So when you see this, for example, in this word, meningomyelocele, meaning that there's a protrusion of the membranes of the spinal cord inside the brain. Okay. Let's think of some other thing. Let's see. Myelocele, I think of another one that uses silly. We don't usually see that all the time. Pathy, disease, pathologist, study of the disease. Encephalopathy, disease of the brain. So N is inside, cephalo is the brain, pathy, disease. Okay, so disease inside the brain. Neuropathy, disease of the nerve. Plasia, growth, development. So dysplasia means abnormal growth, abnormal formation. Neoplasia, what is neo? You guys haven't learned yet. Neoplasia, meaning new growth. Neo, N-E-O, usually means new. Okay. So plagia, paralysis, that means that the nerve function is not well at that section of the body. Let's go through quickly on the neuro disease, multiple sclerosis. Sclerosis is the hardening of the tissue in the body. Fibrosis is fibrous tissue. Sclerosis is the general. So a lot of time, for example, multiple sclerosis is a disease of unknown cause that manifests as multiple hard plaques of degenerating on the insulating layer of nerve fibers in the nervous central system. Okay, so for the people that have multiple sclerosis, usually they have very difficulty of moving their extremity or nerve because a lot of time their neuron doesn't fire the signal to the muscle. Okay, so there's difficulty in functioning. Cardiovascular accident, stroke, that's a fancy name for stroke. Okay. Transient ischemic attack, means not quite enough blood. Epilepsy, seizures, okay, and aphasia. So all these are diseases that related to the nervous system. You could read all this later if you want. So we're not going to spend too much time on those. Let's move on. Okay, nervous system procedures, neurologists. We have a department here that's specifically separate from the major pathology laboratory. We have a neuropathology department. Okay, a lot of the major medical center, particularly like the big academic center, they have very specific department within the pathology. They have a derm pathology, dermatopathology, they have a heme pathology, they have a neuropathology, and other smaller hospital or the community hospital may not have their separate subspecialty. Okay, so for us here and for a lot of other major medical center, in addition to doing the clinical case for the local physician and for the local clinics, we also do a lot what we call the consultation cases, meaning that at a hospital or at the laboratory, they have their case specifically that they have problem with, then they will stand here for a second opinion. Okay, so that's because they do not have that major subspecialty in their own facility. Okay, lumbar puncture, also called spinal tap, and more commonly here in the cytology, we specifically call cerebral spinal fluid, CSF. This is a very important procedure, okay? For a lot of the patients that are going through chemotherapy treatment or some other treatment, they need to be monitored very carefully. And one of the major reasons is for leukemia, lymphoma patient, they need to be monitored to see how the progress of the treatment is. If they're taking, if they're using the chemotherapy drugs for their treatment for leukemia patient. Okay, so for example, if we have a case of a 10-year-old little kid that have leukemia, then for their treatment, they will need to be monitored on the chemotherapy drug every week or every other week to see if there are decrease of the leukemia cells, the abnormal cells, or the lymphoma cells. That way the doctors could monitor whether the treatment is suitable for the kid. If the number of cells in the CSF started maybe, for example, I'll make up a number, 20,000 cells in the CSF fluid at the beginning. And then by 2 months later, the number is still hovering around 15,000, 18,000 cells. Is the treatment being effective at the time? Not really, because the abnormal cells have not decreased. They still have, pretty much the same number of cells. So what they do is they need to monitor the patient very carefully to see if the treatment is effective. If this drug is not working, then they have to change to a different drug. And one way to monitor inside the body is to get their spinal fluid out, to do the cell count, what we call the differential cell count. Okay. And if the cells, the abnormal cells, are decreasing in number, that means that the drug is effective, so they could keep using the same treatment for the patient. Okay. Brain scan, that's just using a CAT scan to brain tissue. EEG, again, that is another recording for the brain activity, the electrical activity. CT scan, that's called the computed tomography CT scan. Have you ever seen the CT scan machine in the X-ray department? Have you seen it?
Yeah.
Okay. So it's like a big machine and the patient laying on a long table and they move in and out. Okay. So what the CT does is they are using the machine to take the cross section of the body on each different level. I think they're like 5 millimeter. Okay. So that a little section to make sure that there are, if they're looking for a specific kind of tumors or if there's any abnormality in the body, then they could really see it that way. Okay. So, has any one of you ever been to the exhibition they call Body Work in the museum?
Oh, no.
No? Okay. If you have a chance in the future, I think they rotate through museum and they come to LA every couple of years. Okay. If you have a chance in the future, I would highly recommend it to go see. It's a very interesting exhibition. They use a lot of the human body and they preserve it in a specific solution. They actually display the whole body in different sections in a real kind of a setting. Okay, so it's life size. Everything is life size. Some people say, "Ooh, that looks so scary," but if you're in a science field or the medical field particularly, it's worth seeing. Okay? And MRI, magnetic resonance imaging, is similar to CAT scan. The only major difference is there should not be anything with metal near the machine. Okay, so because it has a magnetic, if you have anything metal, then it will get stuck to it. Okay, so those are the procedures that we call imaging procedures. What is another common imaging procedures that you can think of besides CAT scan and MRI? Ultrasound. That's another common method to do the imaging for the bodies. Okay, ultrasound. Okay, so there's a quiz. Let's you guys could do the quiz later. Let's move on to the digestive system. Okay. So digestive system, gastro, stomach. I think everyone is familiar with that. Gastritis, gastrectomy. Gastrectomy is removal of the stomach. Usually it's partially. A lot of the people that are going through a weight loss program, sometimes what they do is they do gastrectomy. They take off part of the stomach to make it smaller. Okay, so they don't eat as much. That's part of the procedure. Hepato is the liver. Okay, anything to do with hepat is liver. Hepatitis, inflammation of the liver. Hepatoma is the tumor of the liver. Okay, Clo is the bile, gallbladder. Cholecystitis, cholecystectomy. Cholecystectomy is removal of the gallbladder. Okay. Cysto is bladder sac. Okay, cystoscopy. What is cystoscopy? What is cystoscopy?
The study or looking closely at.
Using the endoscope to look at the bladder, cystoscopy. Okay, that's a procedure that you use the endoscope to look inside the bladder. Usually, they do their procedure to look for any kind of inflammation or cancer changes in the bladder. It means vomiting, emesis, emetic, anti-emetic. Okay, so that's something that often seen in the clinical chart of the patient. Leaf is stone. There's another word for stone that sometimes we use it in cytology is calculite, like calcium, they call it calculite. Okay, so leaf is referred to as stone. Cholecystectomy, that means removal of the gallbladder stones. Okay, how does stone forms in the body? What do you think? Can you guess? From calcium deposit, usually. Okay. Okay. Laparotomy. Lapar is abdominal. Laparotomy is cutting into the abdomen. Nowadays, the medical advances are so good that in the past, when the women, for example, if they have to do a hysterectomy, what is hysterectomy?
Removal of the uterus.
The uterus. Okay. In the past, maybe like 20, 15 years ago, if a woman have to go through a hysterectomy procedure, they have to cut the abdomen all the way to open it up to remove their organ. But now with the advance in medical science, what they do is instead of cutting open the whole abdomen, they call it a minimal invasive procedure. What they do is they use the laparotomy technique. They open 3 little holes on the abdomen area, and they insert the scope, and they also insert a little knife and suction section to macerate, meaning that they break down the organ and get it out. So the patient recover a lot faster instead of having this big old wound in the abdomen and this 10-inch scar. Now they only have the tiny little hole that will heal much better, recovery much faster, and a lot of less bleeding. Okay? So laparotomy is a very common procedure now in the surgery. Okay. Centesis meaning puncture. Abdominal centesis meaning that they try to drain, they puncture the area with a little hole and then drain the fluid. Okay. So a lot of time in our body, we do not have a lot of fluid accumulate in the body. You have water in your body, but the water is pretty much distributed evenly in your body. It doesn't accumulate it in one area. Okay. I'll give you an example for a patient that have hepatitis or alcoholism. Okay, that could cause liver disease called cirrhosis. cirrhosis is one of the liver disease that's caused by either hepatitis or long-term consuming of the alcohol. When that happens, the liver no longer function as well as before. And the result is all the fluid, all the drainage in the fluid, without being absorbed back into the organ, they started accumulate in the abdomen. Okay, so a lot of time, the patients could accumulate up to 2 liters or 3 liters of fluid in the belly. Okay, particularly in men. Imagine a man that have a big belly full of fluid. It's very uncomfortable. It's very difficult for the patient. So there's a procedure called paracentesis. Is they use ultrasound to locate an area that's the most fluid accumulate. Then they insert a really big needles, like really big needles, okay? And then they insert into it and drain the fluid out into the bottles, okay? I could show you in the lab later. We receive a lot of those fluid all the time. Fluid could accumulate in the body due to not functioning well in of the organs. Okay, kidney failure could have fluid accumulate, and when there's tumor or malignancy in the body, that could accumulate. The fluid could accumulate in the abdomen area. When we remove it, it's called paracentesis. When it's accumulate in the chest area, the thorax, we call it thoracentesis. Okay. Okay, trypsin meaning to crush, getting like grinding it into like little thing, okay, little pieces. Rhea means flow or discharge diarrhea. Very commonly, when you eat something that is not agree with your stomach or your GI system, you get diarrhea. Okay. IASIS, abnormal conditions. Okay. Any question so far? Good? Okay. Okay, let's take a look at the digestive disease. Digestive system disease, gastroesophageal reflux disease, what we call GERD. GERD nowadays is very commonly seen. Okay, unfortunately, due to a lot of the fast food consuming, a lot of fatty stuff, a lot of high cholesterol, GERD is very commonly seen in modern day society. Okay, and a lot of time GERD could be related to a lot of other disease. The reflux. You know that between the diaphragm and the stomach, between the esophagus and the gastric, the stomach, there's a little splinter, right? When the food goes through, it opens, and then after that, they close it. But what happens to people that have this kind of a reflux disease is the little splinter doesn't close completely. So the gastric juice come back up, okay? And over time, it could deteriorate that, and then it could lead to a lot of other problems, okay? So GERD is like a chronic disease that need to be treated. Over time, if it's not treated, it could lead to other more serious problems. Or it could even cause cancer in the long term, okay? Because of the changes of the epithelial cells. Jaundice means yellow in French. Usually the bile is yellow, kind of greenish yellow, that is used for digestive. Okay. Diverticulitis, meaning there's a separate pouch in the GI system. Sometimes in the large intestine area, there's a little pouch that's forming. It's called diverticulitis. And those little pouch is actually not very good when it forms, because the food particles, instead of being digested and move out, they could deposit into those little pouch there, and causing a lot of symptoms. Okay, so sometimes when it gets too serious, they need to be surgically removed. Cirrhosis, like I just mentioned, that's a degenerative disease of the liver, developed in chronic alcoholism, but hepatitis could cause one of those too. Portal hypertension. Hypertension is, you know what is hypertension? What is hyper? Over. Tension? Just tension, right? Yeah. So over tension, that's blood pressure. High blood pressure. Hypertension. Okay, let's see, esophageal varices. Varices in the way it's like the swollen vein. Anytime the alcoholism could lead to esophageal varices, the little vessels lining their esophagus could bleed, and then it's a very uncomfortable and painful situation. Dysphagia, difficulty in swallowing. Crohn's disease and peritonitis, those are all chronic inflammatory disease of the GI tract. Okay. Peritonitis is abdominal inflammation, all right? Peritonitis. Okay, specialists, gastroenterologists, those are the physicians that specialize in the GI tract disease. Okay. Proctologists, specialists in the rectum and the anal. So in the GI tract, it's divided into the upper GI, which is the oral, esophagus, gastric, and then the lower GI, which is the colon, rectum, and anus. Okay. So when they do the procedure, there are two. One go through the oral cavity, and the other go through the anus and the rectum up to do the examination. Okay. Endoscope, this is the one that we usually talk about. Okay. There's a lot of endoscopy procedure going on here. Ultrasound, this is another high frequency sound wave to visualize internal organs. Okay. Let's see. Okay, I don't think we need to go through this. You could read this later yourself. And then you guys could do the quiz later.
Mm-hmm.
Okay. So let's go on to. So let's do this brief introduction to cytology. Okay, objectives is to just go over briefly about the cytology field. There are some cancer facts and statistics, basic morphology, and something about cytology training certification. Okay, so when you go to the doctor's office, usually they will say, oh, let's order some lab tests, okay? And the lab tests could include blood tests, it could include urine, or it could include other things, okay? But what happens to that blood sample after they take it from you? Where does it go? What do they do with it? Have you ever seen? No? Okay. Usually they don't know. Say, oh, the doctor say I need to take blood, and then they get the blood drawn, and then that's it. The next time they go to the doctor say, okay, this is the result, blah, 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 blah. But what happened in between? Okay, that's something that we find out. What do they do with the urine sample? I mean, they give you a cup to pee in it, but then what happened after that? Okay. So how does the doctor know the patient has pneumonia, and how does the doctor diagnose disease? So all those that happen in the laboratory, okay? The laboratory is the behind the scene. Usually, when we work in the laboratory, we don't deal directly with the patient, okay? So usually the patients go to the clinics, meet with the doctor orders the lab test, they get the blood drawn, they submitted the specimen, and the specimen delivered to the laboratory, okay? So we are the one that provided the report, but we don't directly see the patient, okay? And the lab works usually could determine the presence or the absence of disease, okay? So when they say, okay, I have this pain in the abdomen, the doctor say, okay, let's take a X-ray or a CAT scan or ultrasound. And then after that, the result could be whether either you have something that's making you uncomfortable or there's nothing wrong with you. Maybe just take some pain medication, things like that, okay? So to determine the presence or the absence of disease, to evaluate the effectiveness of the treatment, like I just said before, the cerebral spinal fluid, to find out whether the treatment is working for the patient by determining the number of cells, the abnormal cells, whether it's decreasing or remain the same or even increasing, okay? To maintain health in general for physical checkup, okay. Many crime laboratory scientists start in basic medical laboratory science, okay? They need to learn all the basics first. And 70 to 80% of all doctors' decisions are based on lab test results. Without the laboratory test results, or without the blood work, without the x-ray, without the CAT scan, the doctors will have no way of knowing how well is the patient doing or what is wrong with the patient, okay? So the lab test, for example, the blood test will show that probably the patient is anemic, not enough red cells. So maybe the patient needs the supplement on an iron pill or any kind of vitamins to make it more healthy, make her more healthy. And many job opportunities are in the medical laboratory fields. Right now, medical science, and particularly in the pathology lab, is probably one of the most demanding in laboratory science, okay? One of the reason is the older generation that have been working in the laboratory science are approaching the retirement age, so-called the baby boomers, okay? So after all those people retired, currently there's not enough of the young ones that are coming in to replace them, okay? For every 4 or 5 retired laboratory technicians, there are probably only 1 or 2 new person replacing the position. So there is quite a demanding of the laboratory. Like for example, this one was a couple of years ago, the statistic, maybe it has changed now. There are about 15,000 new professionals needed, but yet we did not train enough students to fill all those positions, okay? And plus, one of the reasons is people don't know much about the medical laboratory fields, because one of the most common profession when they talk about medical is usually whether it's a nurse or a doctor, okay? People rarely think about laboratory. It's like, okay. So, but now we're trying to make it more aware to people, particularly a lot in the media, on TV. Have you seen the TV show CSI, right?
Yeah.
ER and Grey's Anatomy, all those shows that promote, medical laboratory science and medical field in general. Okay, so for the medical laboratory, there are 2 big sections, okay? Clinical pathology and anatomical pathology. Oh, I needed to add one more here. There's molecular diagnostic now in the clinical pathology side. So what we call CP and AP. Cytology belong to the AP umbrella. Okay, so medical laboratory in general is a big umbrella, and then clinical and anatomical. Anatomical, from the name, that you can see that we are mainly looking at tissues and cells. Okay, so histology is tissue, and cytology is cells. Histology is across this, all the way from us. So in clinical pathology, nowadays this field is actually expanding. It also including forensic and molecular testing in this field. Okay. Okay. Anatomic pathology is analysis of variety of body tissue and organs under light microscope in order to detect the presence or the absence of disease. It could be an infectious, it could be cancerous disease. Okay. So what is cytology? Cytology is the study of cells, right? Cyte is cells. What do? Our job majority, we spend most of the time examine the human cell samples under light microscope. Okay, for cancer, precancerous changes, infections, and other disease. So if we see a case that have only normal cells, nothing's wrong, then we could finalize the report and send it straight to the doctor's office. Okay. However, if we found abnormal cells in their cell sample, then we need to send that case to a pathologist who is a physician, because we are not a physician, okay? So we are not trained medical doctor. We cannot make the final call on the cases that have abnormal cells. So what we do is we mark the cells for the doctors, for the pathologists, and then we send it to them for them to review. When they agree, then they will finalize the case, and then the case report will go straight to the doctor's office. Okay, what's cancer? We talk about that, right? Cancer is in Latin, derived from Latin meaning crab. So normal cells usually divide and grow in an orderly fashion, but when it's abnormal, the cancer cells grow out of control and spread to the other part of the body. Okay? But important, most type of cancer can be prevented or treated if found early. This is the key word, if found early. Okay? Pretty much a lot of disease, if they were found early and treated, the patient could be cured. But if found too late, then it's more difficult. Okay, so these are some of the statistics that was presented in American Society, Cancer Society. Most of the most common type that's seen in both men and women are the cancer from the lung. Okay, so lung cancer is still the #1 killer in both men and women. And for men, followed by prostate, colon, pancreas, liver, etc. Okay, so this are the kind of figure that the National Cancer Institute of the U.S. and the CDC, Center for Disease and Infection Control, also keep the statistic for every hospital and every laboratory. That's how they come up with all this number. Okay, so for example, if UCLA have treated or have seen the patient, maybe 2,000 patients per year with lung cancer, they will report that figure to the Department of Health in California. And then the Department of Health in California will report that figure to the National Cancer Institute and CDC. Okay, and so that's how they collect all this data here. In women, also the top one that's most common is still lung, and the second most common is breast cancer. Okay. Did you notice that there are no cervical cancer, pretty much? Very few, uterine corpus. Okay, that's because we have the screening system here. Okay. Okay. Trends in cancer death rates among men, again, bronchus is the #1. Notice that between 1930 and 1970, it's going straight up. Why is that?
Pollution.
Hmm?
Pollution.
Pollution? Who could be? What's another major reason related to in men?
Smoking.
Smoking, very good, yeah. Because at that time, they do not really understand the effect of the tobacco and the cigarettes. Okay, so smoking is a very common thing. And that's the time when you see a lot of lung cancer cases. But by 70s and 80s, a lot of the anti-smoking campaign, anti-cigarette campaign started. So that's why you see the trend is still going down. Okay, it still occurs. There's not a lot of, it's not completely eliminated yet, but definitely it's going down. So smoking and cigarette is not the only risk factor, or it's not the only reason, okay? But it's one of the major reasons, right? And then colon pretty much remain the same up until 80, and then it's going down here. During the 70s and the 80s, a lot of disease started going down, so to speak. During that time, there's a big transformation in the medical field in the U.S. A lot of the guidelines started to appear. The guidelines are the recommendation for the physician to talk to the patient. Okay, so during that time, they started to publish the guideline. For example, for colon cancer, they recommend that the patient should start to have their colonoscopy screening at age 50. But prior to the time, there's no such thing. people don't go for screening, okay? You only show up to the doctor whenever you feel some symptoms, or you feel uncomfortable, or you feel pain. And a lot of time, by the time you feel something, the symptoms and signs is already a lot, more difficult to treat. So because of they started to publish a guideline and recommendation, people are going for physical exam every year, okay? Once you start, once you reach age 50, then you start your first colonoscopy screening. And I think it's every 5 years to do the second one. Or if you have any other disease, then it's more common, okay? Another example is for women. American Cancer Society recommended that women start having their first mammogram at age 40, okay? So, and because of that, when they have the mammogram, then they could detect a lot sooner whether there's any kind of abnormal growing in the breast. A lot of time, you are the best person to know your own body, okay? So sometimes people say, oh, I feel something in my breast. Let's go to the doctor and have it checked out. The patient may be in their 30s and not reached the age 40 yet, okay? So it's good to know your own body and do the self-breast examination, okay? Especially young girls. There's a lot of going on in your body, hormonal changes, so you need to pay close attention to your body. Okay. In women, again, slightly increase here. Tend to notice that for men, the red line goes like this and drop, right? But for women, when does it start going up? Like right around the 70. What's happening at this time? What do you think? Freedom for women. Liberation, right? Before that, women was more conservative. Okay, it's always men. But now the equality of the both sex, so women are more liberal to do more, including smoking like men, unfortunately. Okay, so but that's one of the things too is smoking is not the only reason, but it's one of the major reasons.